So when you look at a tummy, you're basically looking at three things. You're looking at the amount of skin or extra skin you may have. You're looking at the amount of fat or extra fat you may have. And you're looking at the muscles that may or may not be tight underneath. So you have three options. You can do a purely liposuction of the area, and that works if the skin is pretty good. There's no muscle looseness, and all you have is a little bit of fat. The pinch that you grab when you examine the abdomen will get skinnier. The skin will shrink down to some extent, not completely, but it will shrink down to some extent, particularly if your skin is young and elastic. If you have too much skin and or too much fat, you may need an abdominoplasty or tummy tuck. Now, there are two types of tummy tucks. There is a mini tummy tuck and a regular tummy tuck. The difference is based on what the skin looks like above the belly button, because the belly button is sort of like a thumbtack that holds the skin down. And if you have extra skin or too much fat above the belly button, you'll need to detether that thumbtack and have a regular tummy tuck. So let's go through the tummy tucks. First of all, the mini tummy tuck is a shorter line down in the C-section area, a little longer than C-section, but not all the way across. We pick up the skin all the way up to the belly button. We can tighten muscle if necessary, but most of all, we're addressing the extra skin and fat that's below the belly button. We pull the extra out, we cut the extra off, and we sew it too. So you end up with a incision below the bikini line, no incision around the belly button, some skin removed and fat removed below the belly button, and maybe some tightening of the muscle below the belly button. That's a mini tummy tuck. In a regular tummy tuck, you do the same thing with a longer incision, but you have to detether the belly button, which is that thumbtack. So you make an incision below the panty line, incision around the belly button. You lift all of this up, all the way up to the rib cage. If necessary, you will tighten the muscle all the way up and down with some permanent sutures if the muscle's loose. Then you bend the table, you pull the skin down as much as you can, and you take out the excess. In a regular tummy tuck, you end up with an incision that's a bit longer, but in the bikini line still, and an incision around the belly button. So, in summation, the three things that you can do with a belly or an abdomen is you can do liposuction, you can do a mini tummy tuck, or you can do a regular tummy tuck or abdominoplasty.